Thank you for calling Inovalon. If you know your party's extension, you may enter it at any time. Thank you. This call may be recorded or monitored for quality and training purposes. If you are calling in reference to a request for medical records, please press 1. If you are calling in regards to scheduling an on-site review, please press 2. To contact a representative,
You had mentioned, and you said you were going to put in something into the computer about HIPAA. Will you tell me what you were saying before?
What do you mean?
Well, I asked you not to write any kind of conversation or any sentences into the system, and you had mentioned just before I left that you were going to cite something I talked about HIPAA.
I believe I said that this is something that was that is bothering you and something that has been consistently bothering you.
So I asked you, not to write anything into that system. I asked you to write it in for your own, personal notes locked away, not the system. And see, the reason I'm calling is to let you know that really bothered me. I must tell you, it created a lot of problems. And what it did, it made me very upset when I left. And I tried not to call and let you know about it. But then I started thinking about it, and it was like, why, you couldn't just, respect the wishes for the circumstances that I'm going through.
This is standard in all of healthcare. If you see a patient.
So the thing is, it's standard, but something's not standard. Right now, I told you that something happened, and under the circumstances, something unstandard happened, which I'm asking you just temporarily not do anything. But you did it anyway, and I asked you kindly not to do it. I wanted this to work, but I'll tell you, I asked you not to type any kind of conversation content in that system. Forget about standard. I just don't want it in there, and it's not required. Maybe your boss wants it, but it's not I'm not working for your boss. I'm actually paying you, and that's really what I want.
It's a standard policy here. That's something I can't change.
I just don't want you typing in conversation content. It's not a policy. I'd asked you just to write it on paper, whatever you can do if you feel like it. I just don't want it in the system, okay? That's really all I want. And it's not policy.
It is policy. I'm sorry. I asked to before I typed in.
Right, but actually I never even mentioned about HIPAA. You realize that? What I said was I went to some guy's place and I said he felt that he violated 508(2). I may have mentioned about his sign authorization or something in my file, and all you heard was something about law, medical file. It must be HIPAA. And he put words in my mouth. I never said HIPAA. I don't know if you're aware of that. And the thing is that if you're going to write notes in there, then I got to document our conversations. I got to end up recording it because I'm not sure if what you write down is accurate. This is what I went through 7 years. A lot of that stuff is inaccurate. Some of the things he wrote down were not even true. And I'm going through a lot of personal stress over that. And you couldn't just for the acceptance and under the circumstances, you couldn't just accept that. It's not even that big deal. And really, if I'm going for medicine, I'm not looking for someone to transcribe what I say. It really has nothing to do. I'll let you think that over, but I'm letting you know that really upset me, and it created a lot of personal distress. Just that alone. Have you not said, if you had kept your word like the last time, remember you told me you didn't write something on the session prior to that. Remember you told me that. And then when I end up leaving the second session, you said you were going to type in HIPAA, and or something about that conversation. And perhaps maybe I shouldn't really be, it's the first time you said that, but perhaps maybe I shouldn't really be talking then. Okay, that's fine. I can do that. But my saying is when I left, you changed your answer to now you're going to write something, and have you told me that prior, this wouldn't cause me to be very upset and distressed. It really, it's that system that ended up going into the insurance company, and he wrote down a lot of offensive things, and a lot of strange things happened since 2013 all the way to now, and it's the worst thing that ever happened to me my whole life. But I'm glad thank you for listening to what I have to say. I'm just letting you know. Perhaps maybe you need some time to think about, what if we can come up with some solution. But I really have a problem with information in that system. I really do. It's like I have a problem with it. I feel violated. Somehow this stuff went into the insurance company, and those people are nasty. The answer's never straight with them. They tell me one thing, and then they tell me another. So, something really bad happened to me, and it all became because somebody wrote things they shouldn't have written in that system, understandably. And I'm sure you're more professional, but even then, I'm still very distressed over what happened to me. And I'm just, that's all I want, that's now my peace of mind, and thank you for listening to me. I'm sorry to trouble you, but that's basically what it comes down to.
Thank you for calling.
Okay, thank you.